Go ahead.
Hello everybody, my name is Rick. I do a massage on many of the residents here. I've been doing it for many years, and just give you a little insight on how to approach massage with some of the residents. First of all, you have to understand the older generation will have very thin and delicate skin, and you need to assess the skin area first. Make sure that there's no bruising, no tears, or any cuts that you possibly, by touching, could cause infection or hurt them in any way. Most residents are on some form of blood thinners, and therefore they're easily bruised. They can bruise very easily. So you want to make sure that the touch is very gentle. And when you're massaging, sometimes you'll feel a little bit of like bumps or something, a little more firmness to the skin, and that's an area probably where the muscle is tight. And so when you do apply pressure, just to go very slow and gently go into that tighter tissue, and just gently possibly do side to side motions, or circular friction it's called. And that will help release that muscle tension. When you use cream or the oils, I make sure I don't use too much most of the time, unless they're planning on having a shower the next day. You don't want to get them all too oily, but it's good for their skin. The cream that I use soaks in. But as you can see here, I just do gentle application of the cream, nice and smooth, and kind of long strokes. And then it can work up into their calves. Again, the long strokes. And it may appear that I'm going deep, but I am not. I'm just very gently just supporting their leg and gently going into the fibers. If you were to see the muscles, actually, you'll see fibers of the muscles are going this direction, and when there's some kind of a bump or some tightness in your muscle, you kind of want to think of it as a straw with, say, spaghetti in the straw, and that all that spaghetti inside that straw is stuck together, and you want to break that spaghetti up. So if you were to find a spot, say right here, you just go roll that straw back and forth until that spaghetti breaks up, and that will basically relax that muscle and get that bump to release. That's a very generic way of describing it, but hopefully that makes sense to you. Going on to the foot, obviously some may be ticklish and pull away, so you have to be careful about that. So when you get onto the bottom of the foot, you might have to put a little more pressure on the bottom of the foot. The more pressure, the less ticklish it will be. The bottom of the foot can usually take more pressure than the rest of the part of the body. And again, on the bottom of the foot, the bones are going this direction, all the muscles are going this direction, and in between the bones. So when you're pressing underneath the foot, you kind of can feel the bones. You want to go in between the bones, not necessarily pressing on the bone. That can be tender for some when they're having some deterioration of the joints and the bones. Also, just osteoporosis, where you get muscle, or the bones are deteriorating. You got to be very careful not to, say, if you're going to bend thinking that it's going to feel good to stretch, you got to be very careful, because you don't want to break any bones. So chances of that are very slim, but you always want to be on the safe side. The heel portion of massage feels very good if you get really deep into the heel. There's a lot of nerve endings in here, and it's very tough skin, so you have to kind of push hard into there. And that releases a lot of tension that goes up the back of the leg. And then also on the bottom of the foot, you have a spot right here and exactly on the other side. And all the muscles that come down, it wraps under like a stirrup and goes here. The muscles on the inside come down and wrap and go to the outside. So these two spots are where all those muscles attach, and it can be very tender. So just a gentle press on those spots can help release all the muscles on the inside of the leg. You go on the inside of the foot, that same spot will release a lot of the muscles going up the outside of the leg. There's many trigger points on the feet and throughout the whole body, but the trigger points on the feet, this represents in reflexology your whole body, your organs and everything. So there's certain spots on your feet that you can press that can help with digestion, sleeping, your heart, etc. And I can provide you with that map, and then you can all see that. And so when you're massaging, you can kind of focus on areas if you want it to be specific. And yeah, I'm talking kind of detailed, but it does feel very good to go in between the bones. But you always have to remember that the massage has to be that caring and loving touch. You don't want to constantly be finding things and poking, and you want to continue to add the feel-good strokes. So they get a benefit from the massage, plus also the relaxation benefits. Plus this helps with the circulation